Hi, I'm Michael Weiden. I'm a professor of pulmonary medicine and environmental medicine at NYU School of Medicine. I have been taking care of the firefighters in an occupational medicine setting, and over the last 7 or 8 years, I've been looking at what are the consequences of exposure to dust and smoke at the World Trade Center when it collapsed. Smoke exposure is one of the great causes of disease, and lung disease is one of the top 10 killers in the world. Cigarette smoking is extremely well defined as a cause of lung disease, but now with more pollution and with things like smoke exposure in the home, we understand that a lot of lung disease is not due to cigarette smoking, but can be due either to smoke exposure elsewhere or environmental pollution, such as particulate matter that you inhale. The exposure to dust and products of combustion at the World Trade Center produced a very high burden of respiratory disease that presents as cough and shortness of breath. A significant proportion of these individuals have declining lung function over 17 years of follow-up after the event. Spirometry is a simple test that can be done almost anywhere with a handheld device. It is easy to do. There is a tremendous amount of experience with spirometry over the last 20 to 30 years. And in general, it is a reasonable test to look at lung function in large groups of individuals. But it does a very poor job of predicting who's going to have symptoms. And it does a very poor job of predicting what any specific patient is going to do in terms of their response to therapy and whether or not they die. Spirometry is a very poor endpoint for early detection. The human lung has tremendous reserve, and you don't see abnormalities on spirometry until 30 to 40% of the lung has been damaged by any disease process. It is a test. It is a widely available test, but it has lots of problems associated with it, mostly in terms of poor sensitivity, detecting things early, but also in terms of specificity. Two people with very different diseases can have identical spirometries. Spirometry is a global test of lung function that has no capacity to look at different regions of the lung. It is a bulk measure. We had the opportunity to get clinically indicated CAT scans on over 4,000 World Trade Center exposed firefighters over 17 years of follow-up, and we observed that high intensity exposure increased the risk of CAT scan abnormalities, and that CAT scan abnormalities correlated very well with longitudinal lung function and more sophisticated lung function measures. We're interested in trying to understand how imaging can fit in to detecting disease early and how it can drive treatment. Imaging has the opportunity of identifying people who will benefit from treatment, get them into treatment earlier, and hopefully improve outcome. I think that AI is an extraordinarily powerful technique, which is at the cutting edge of looking at large data sets. And large data sets include a lot of imaging information from a single patient and imaging information from many, many patients. The advantages of artificial intelligence, and in particular machine learning, is that we are not bound to our preconceived notions. We are able to see predictions that may have been surprising, and we never would have guessed it before, and that the machine learning process reveals structure and associations that we never would have predicted before. Then you have to do the hard work of seeing if those predictions lead to clinically relevant outcomes and treatments. There is no question that artificial intelligence is the wave of the future in terms of personalizing medicine and optimizing patient selection for various